So in looking at what can begin to happen throughout the travels of the fluid, I tried to find a view that would make it a little simple for us, okay? Because there is something taking place at every single step along from the time we get the filtrate until the time it becomes urine, okay? So, what we're going to say is that we have the process of filtration, we have the process of reabsorption. Why do I say, or why is it said reabsorption?
Is it only taking, when it does reabsorb, is it only taking it from the glomerulus, that area, or does it actually continue?
Yeah, there'll be stuff that occurs all along the pathway. But why the term reabsorption?
Was through the blood system, they absorbed some until they got there.
Because we'd already absorbed something once. So at this point, anything that happens, we are reabsorbing it. Exactly. So we have reabsorption. Now, secretion is another process that we're going to have. And then, of course, our excretion. So they're trying to give us this overview of what's taking place. So at this point right here, blood enters, blood gets pushed into this glomerulus, and this is the process of the filtration. And it's giving us our fluid that's going to make its travels. Now note, they're trying to show us the capillaries that I mentioned before, these peritubular capillaries. Okay? So, let's kind of look at what's occurring. Reabsorption, secretion, excretion. So if we follow our fluid and we're in the proximal convoluted tubule, they're showing me that this fluid moving through the proximal convoluted tubule, we're going to have the process of reabsorption occur. So that tells me materials are going to move out of the fluid, and where does it show them moving to?
Into the blood capillaries.
Into those peritubular capillaries. Now, what does it show happening at this peritubular capillary? We've got some secretion. Well, hello.
She just hung the thing at the grill.
Yeah, that was weird.
Yeah.
I guess that lost its sticky. That's creepy. Is that like an indicator of the command strips? Timex takes a lick and keeps on ticking. Okay, so note, it tells me I have some reabsorption. Stuff will move back into the capillaries. Something will happen from the blood. I will continue my flow of the fluid. Okay? So my flow of the fluid, now note, when I am on this descending limb, they're letting me know it's reabsorption. I don't see anything with the secretion. As I go around the loop, not much of anything. Okay? A little bit, all right? As I begin the ascending loop, once again, stuff will move from my tubular fluid. As I get to the distal convoluted tubule, once again, I'll have movement between the fluid and the blood. And then, as I move along the collecting duct, I'll have stuff move between the blood and the collecting duct before it becomes urine. Does that kind of make sense of that picture? Okay. So the nephrons, I keep mentioning that we have two types. One, very short, One, very long, dips way down into the medulla. So we're going to say that we have cortical nephrons, okay? Then we're going to have juxtamedullary. Now, cortical, these are going to be at the border of the cortex and just a small portion into the medulla. These make up the largest majority of our nephrons. Now, our juxtamedullary. Got a little bit in the cortex, but the majority dips down into the medulla. What do you note about some of the differences other than their length?
The capillaries.
The
go all the way down
capillaries.
the tube on
The ones that dip way down, the juxtamedullary. This capillary network is termed the vasa recta. Up here, that capillary network is more around this DCT, PCT. Okay, is everybody kind of following me on this one? All right. The loops that we're going to find in this medulla region, the juxtamedullary only make up about 15% of our nephrons, but the loops maintain osmotic gradient in the medulla. So I've got my cortex, I've got my medulla, all right? And the medulla has those renal pyramids, right? Okay? This medulla portion, we need to have an osmotic gradient. What does that tell me?
Movements of cells.
All right, so we're going to have something dealing a lot with salts. Okay? And that's going to have to give me a gradient. Now, if I have some nephrons that are going to dip just a little bit, and then some that are going to do this number, okay? There's a reason for this. At the point when the fluid is moving through these tubes, okay? One of the things we need to make sure we do, help conserve water. If I have a gradient of salts, and a gradient means it's going to kind of increase or decrease, right? All right? So if I increase my salt concentration as I go like this, down that pyramid, okay? If I'm at the proximal and I'm coming around this loop, and I need to make sure I get water out before we end up in this collecting duct to make urine. Otherwise, if I didn't worry about the water content, what would happen to my urine?
Concentrate.
Not concentrated, but if I didn't worry about trying to conserve water, my urine would be very dilute. Okay? So I need to make sure that I can return water to the body. Okay? So if I have a salt concentration that's low, goes a little bit higher, a little bit higher, a little bit higher, way high, so that when I'm down here, all right, what do you think water will begin to do?
move out.
Water's gonna move out. That's the purpose of this gradient. But we have to make sure we maintain that gradient in this medulla.
Does that adjust the pressures as it's going through the loops?
Pressure of the fluid in the loop,
Yeah, as it comes down the
I don't think that's gonna have as much to do with the pressure in the loop as it does getting the water out. So basically, it's gonna be more of a pressure on the outside versus the inside of that loop, so that we can get the materials to move, but not so much the fluid itself moving through.
And so the salts, are they in the medulla or in the nephron?
They're going to be in those tissues that the nephrons are dipping down into. So the fluid is what's moving through that nephron tube, okay? And that's still got tissues all around it. So the salts are going to be in all those tissues surrounding it.
Okay, so just confused when you said the water is gonna come out, but the concentration is in.
So if we look at it, salt concentration is going to be high. All right, so that tells me out here in the tissues, my water is low. In my tube, water is high, salts are lower. So it's going to want to move with the concentration gradient. Okay? The other part about some of this anatomy, the kidneys are going to be innervated. The renal innervation, if we look at the structure of the kidneys, we're going to find that we're going to have a renal plexus. It's going to be wrapped around the artery of the kidney. Okay, everybody notice my terminology. It's wrapped around the artery of the kidney. The fibers from the nerve will reach the blood vessels and the convoluted tubules. So these nerve fibers, they're going to branch and they're going to branch and they're going to branch and they're going to branch until we get to the point where we have our nephrons and the tubes, the convoluted, the PCT, the DCT, will have a fiber innervating them. That's how much that nerve is going to travel, all the way down to the nephron itself. Okay? We have sympathetic innervation. Do we control that? No. Okay? The sympathetic nervous system, it can reduce the glomerular blood flow, meaning the blood going into that arteriole at the glomerulus. And if it can affect that, that is going to affect our urine production. Because if I don't have as much blood flow going into it, I'm not going to have as much urine output. Is that correct? If I increase the blood flow, I'll have more urine output. Is that correct? Possibly. Now, a good thing that this can do, it can respond to drops in blood pressure. Some people when they get up really quickly, maybe go from sitting to standing or lying to standing, takes them a minute, okay, to kind of get over the little wee feeling, all right? That's a drop in your blood pressure, and that's your body having to respond to it. And one of the things it'll do, it'll affect the kidneys. A huge drop in blood pressure, such as maybe shock or trauma, okay, this system will help with the blood pressure and the control to the kidneys. So now we have to take all of these parts and we're going to begin urine formation.